What is an admitting clerk? An admitting clerk is a hospital staff member who is responsible for the process of admitting patients into the hospital. Their main duties include gathering information. The admitting clerk collects personal, financial, and medical information from patients and their families. This information is used to create a patient's medical record. Verifying insurance. The admitting clerk verifies the patient's insurance coverage and ensures that all necessary paperwork is completed and submitted. Assigning rooms. Based on the patient's medical condition, the admitting clerk assigns a room and arranges for any necessary equipment or services. Communicating with other departments. The admitting clerk communicates with other departments, such as billing, nursing, and lab, to coordinate the patient's care and ensure a smooth admission process. Answering questions. The admitting clerk serves as the patient's primary point of contact and answers any questions they may have about their stay in the hospital. The goal of an admitting clerk is to ensure that patients have a smooth and efficient admission process, and that all necessary information is collected and organized for their care. This includes ensuring that the patient is comfortable and informed about the hospital's policies and procedures. A typical day for a hospital admitting clerk might look like this. Greeting patients. The day starts by greeting patients and their families and helping them complete the necessary admission paperwork. Verifying insurance. The admitting clerk verifies the patient's insurance coverage, ensuring that all necessary forms and authorizations have been completed. Assigning rooms. Based on the patient's medical condition and insurance information, the admitting clerk assigns a room and coordinates with other departments to prepare for the patient's arrival. Inputting patient information. The admitting clerk enters the patient's information into the hospital's computer system, creating a medical record and updating the patient's insurance and billing information. Answering questions. Throughout the day, the admitting clerk answers questions from patients, families, and staff, providing information about hospital policies and procedures. Coordinating with other departments. The admitting clerk communicates with other departments, such as nursing, laboratory, and billing, to coordinate the patient's care and ensure that all necessary information is gathered and organized. Filing and record keeping. The admitting clerk maintains accurate records of patient information and ensures that all admission forms and other documentation is filed appropriately. The goal of an admitting clerk is to provide a smooth and efficient admission process for patients and ensure that all necessary information is collected and organized for their care. This includes answering questions, coordinating with other departments, and helping patients and their families feel informed and comfortable throughout the process. Thanks for watching.